Of the new cases, which included Kasama, Mungu, and Soga, all these had passed through Nakonde, and everyone is asking how can we stop the cases and the human spread of the coronavirus. So I kindly hope that Professor Benson will guide us today.
Countrymen and women, members of the press, good morning. So this morning I provide the nation with the update on the coronavirus disease outbreak in Zambia. In the last 24 hours, I wish to report that we have conducted 495 tests in our laboratories. And out of that, we have recorded 60 new cases across the country. But the bulk of the cases are coming mainly in Muchinga and Copperbelt provinces. So the breakdown is as follows. 48 positive cases were detected from 307 samples which were collected from Muchinga province and tested in our UTH virology lab. And these 48 positives include 4 health workers. Then we have 24 from the community screening and testing, which is taking place right now in Nakonde, and then the 17 of them were contacts to non-positives. And then we had 2 truck drivers who came into the country through Nakonde. And lastly, 1 patient who presented to Isoka General Hospital was being treated for pneumonia, and routinely we tested for the COVID. The other 12 positive cases were confirmed from the 188 samples we tested at TDRC laboratory in Ndola the last 24 hours, of which 8 of them are truck drivers who entered through Nakonde to deliver fuel at Indeni. So we did an operation where we escorted these trucks up to Ndola and then also tested the drivers. So 8 turned out to be positive. And then we have a number of isolated cases in different districts recorded. So 1 case was in Kitwe. Again, this is a person who traveled from Nakonde, who works in Nakonde, but traveled to visit the family on the Copperbelt in Kitwe, and routinely went to be checked and was found to be positive. We have also a case in Mpulungu. Again, this is a bus conductor. They operate a bus which moves from Nakonde to Mpulungu and back. Then the other case came from Nsenga Hill. Again, this is a business person who usually travels to Nakonde for supplies. And then the last case was from Kasama. Again, this one was picked through our routine community testing. Again, it's an adult male with a history of traveling to Nakonde. So as you can see, a number of the cases we have seen in the last 24 hours are all linked to the main source, Nakonde. Just to report that all the contacts of these new cases were actively tracing and being screened. In terms of discharges, today we have 5 patients who've been discharged from Levi Mwanawasa Isolation Center. So the cumulative number of cases now stands at 832 and includes 7 deaths and 197 recoveries. We have continued monitoring the 14 days mandatory for people coming into the country. And today I report that a total of 4,407 have successfully completed the 14-day mandatory quarantine and are being integrated into society. We have been investigating a lot of alerts across the country, just to indicate that we have done now 2,276 alerts which have been notified. At the global level, the cases still continue increasing. Globally now we are reporting a total of 4,989,000 COVID cases, which includes 324,966 deaths and 1,959,260 recoveries. This is at 08 hours this morning on the 20th of May, 2020. In Africa, again, we're still seeing rise in the number of cases. Today, we are at 3,149 new cases reported in the last 24 hours. This brings the cumulative numbers of cases now in Africa to 93,229 and includes 2,925 deaths and 36,809 recoveries. In our region here, the Southern Africa region, again, the numbers stands at 18,536 cases with 332 deaths and 8,375 recoveries. And then for Zambia, amongst our neighbors, the cases around us now stands at 2,493 cases with 93 deaths and 609 recoveries. Countrymen and women, members of the press, again, I wish to report that we have continued scaling up in the implementation of our preventive and control interventions throughout the country. We are in Chilundu. This is day 3. We are doing the community screening and testing. Yesterday, we have gone to 277 people we have screened, tested, and these include truck drivers, point of entry staff, and members of the community. We have collected the samples and we are running testing them in our laboratory. Nakonde being the epicenter now for the country, we have intensified our activities there. A package of interventions we are doing. We're hoping to quieten the situation. So in addition to what I provided yesterday, we have trained quite a number of community health workers who are going to supervise the home isolation management. Included in that, we have trained also 18 nurses who will be part of supervising the community health workers. Furthermore, 30 health workers and another 30 point of entry staff have been trained in infection prevention and control. So the mass screening and testing continues even today. Our teams across the country will continue in terms of the response, intensifying in case management, port health, case detection, contact tracing, infection prevention and control, risk communication, and the community sensitization. So members of the press and fellow Zambians, this fight, we need to fight it together. And I'm quite positive that we should be able to conquer it as long as we adhere to the measures stipulated under our Public Health Act, CAP 295, and our statutory instruments 21 and 22 of 2020, together with the presidential directives. Key to winning the battle, as we adjust to our new way of living now, taking into consideration the COVID, it will be with us for a while. But if we adhere to what we are requesting every responsible Zambian to do, then we'll get back to our normal way of life, adjusted, of course, to ensure we avoid public gatherings. We ensure in public places we're using the masks because they create a barrier. We also frequently keep our hands very clean through frequent hand washing, maintaining personal hygiene and environmental cleanliness. Keep practicing physical distancing, no handshakes, restricted movements, and report any of the suspected cases or yourself if you are not feeling well. These we will keep repeating because it requires a change of mindset and also behavior change. If we adhere strictly to these, we will transition into the adjusted normal way of our life, which will take into consideration the COVID, which is with us. So it's important we act collectively, adjust into our new way of life, and also take into consideration that COVID is there and it's real. So preventive measures are very, very key for us to win this battle. So that's a key to the public, that let's act responsibly in a collective manner, and we shall conquer COVID. We get back to our normal way of life. That's the update for today. Thank you very much.
Countrymen, women and the youth, colleagues, journalists, that was Chairmanship Public Health Institute Director, Professor Victor Mkonga, giving us an update. Juncture, I would like to invite questions from the members of the press, and we use this microphone on the far right here. And as usual, we'll take 3 questions in a row. We have questions, clarifications. Well, we don't seem to have any clarifications or questions, meaning that the update professor was loud and clear. And maybe I'd just like to maybe invite you to maybe summarize the figures of today's update, just in case the viewers out there or some members of the press would have missed out the figures. Professor Mkonga.
Thank you very much. Just to re-emphasize that our focus still remains on the surveillance, looking for cases. Active surveillance basically means that we move in the community, look for the cases, and those positive, we ensure that they are in isolation so that they are not spreading the infection. The strategy with that is we need to pick the cases very early before they develop full-blown signs and symptoms and manage them. And again, it's our targeted community screening and testing. That's the only way we can pick the cases. We also need to control and shield our border areas. That's why you have seen a lot of emphasis on Chirundu. We've been into Livingstone and Kazungula and Nakonde, and we are targeting Kasumbalesa also to clean up. Then we stop these cases coming into the country. So it's key now that we are going into the cold season. Normally that's when the flu illness picks up. Also it's key adhering what we are saying, because we are beginning to see now the local person-to-person transmission in our compounds. So the ball game may change. So in summary today, countrywide, we tested 495, which we ran in our laboratories, both at UTH and TDRC in the last 24 hours. And out of that, we have 60 new positive cases. The bulk of it, which is 48 positives, are mainly coming from Nakonde. And then we have a few scattered, but again, the bulk, they are all linked with the cases coming from Nakonde. So cumulatively, as a country, we stand now at 832 cases, which includes 7 deaths, and we have discharged, or people who have recovered is 197. Thank you very much for your continued support to the press in this journey. We count on you. Thank you.
Well, we've come to the end of our update. We'll date you tomorrow at the same time.
Thank you.